National Public Health Week is a great time to recognize public health and highlight issues that are important to everyone in our community. Today, we speak with Susan Polan from the American Public Health Association. We discuss climate action, health equity, advocacy, and the future of public health. And later, how much coffee is too much? Is that even a thing? We chat about some of our favorite caffeinated drinks, including some from days gone by. Does anyone remember Surge? All that and more coming up on Health is Real. Come on in, stay a while. Andrew Stinson here alongside Angela Taw and Zach Watson. The name of the podcast is Health is Real from Franklin County Public Health. We're coming to you today from Memorial Hall in downtown Columbus. Angela, how are you doing today?
Really good. Thanks for asking.
Wonderful. And as always, Zach Watson is here beside me. Zach, how are you?
I'm doing just fantastic. Thanks for asking, Andrew.
No problem. Well, I'm really excited about our guest today, and it's our first virtual guest. We're really using the technology available to us to its full limits right here.
Yeah.
We're excited to bring on Susan Polan. She is the Associate Executive Director for Public Affairs and Advocacy at the American Public Health Association. Susan, how are you doing today?
I'm doing very well, thank you, and I'm really excited to be your first virtual guest. I did not know that I had that honor, so it's really nice to meet all of you.
Yes.
History.
History in the making, absolutely. So
Really, you get a chance to do that.
I know. We're making history today. So for those of our listeners who may be unfamiliar with the APHA, can you tell us just a little bit about what your organization does and what you do there?
So APHA is a membership organization. We're a nonprofit, and we really focus on the support and goal. Our goal is to improve the public's health. So we don't think about issues like making sure healthcare providers are reimbursed through Medicare. That's not what we do. We really think about population-based approaches to improving the public's health. So we focus on policy, advocacy, education, convening of groups, really trying to engage the public health profession, the students who are part of public health, and partners, because if you know anything about public health, you know that we're everywhere. And the issues that we deal with really are complex and holistic, and from the minute you get up to the minute you go to sleep, and actually when you're sleeping, public health is impacting your life. So we really focus on those big, broad issues. One of the core principles is that we assure that everybody has an equal opportunity to be healthy. So equity is one of the things that is built in, not just to public health, but to the way that APHA works. In addition, we really are sure that everything that we move forward on is based in evidence and science. So we are not trying to understand the world by hearsay or anecdote. We really do try and focus on evidence and science. I am the Associate Executive Director for Public Affairs and Advocacy, as you said, which means that in a lot of ways, what I do is the external relations for the association. I oversee our departments of government relations, communication, membership services, and affiliates. We have a group that we have been working with called the Alliance for the Public's Health, which is trying to bring together partners in cross-sector organizations to focus on issues related to improving the public's health. And so I oversee that as well. And then I do everything else that my boss assigns me. I think it's true for most of us in our
Yes.
Don't we all, right?
Yeah.
Yep. So the cool thing that we get to see each year as a public health organization from the American Public Health Association is National Public Health Week. That's something that we always get really excited to see every year. But can you just speak a little bit to what that's all about and kind of how it got started?
I can go really far back. I can do the more recent history. But this year we're celebrating the 30th anniversary of National Public Health Week. And it's the 30th anniversary of when President Bill Clinton signed National Public Health Week into a proclamation saying that the first full week in April every year is the opportunity to celebrate public health, to talk about the work that public health does to create activities and events nationwide. And it's always so exciting for me at APHN when I'm wandering around in the world doing my normal stuff to see other places celebrating NPHW in their own way. We really like to see this is a community-based opportunity for people who don't necessarily always have the chance to say, public health is here, it's doing good work. This is the kind of stuff we're doing for your community. what can we do to engage and how can we help move it forward? So it is an education opportunity, it's an advocacy opportunity, it's a celebratory opportunity.
That's awesome.
Yeah. So, speaking of National Public Health Week, yeah, the theme that was chosen was "It Starts Here," with different days focusing on different topics. We particularly think this is a really cool theme because there are so many levels where change can start from the national, state, local, and individual levels. Um, when we look at these individual days, we know here at FCPH what we're doing with these certain topic areas, but we wanted to hear from you on why these topic areas were picked. So, for example, climate action. The first day of Public Health Week is climate action. Talk to us about why this was selected.
So the thing to know about APH or National Public Health Week this year is that we really are trying to weave these things through all parts for the entire week. And so climate action, we're doing specific events throughout the week and not just on day one. So just as for folks who are out there thinking about it, they don't have to do climate events on day one of National Public Health Week. Take your time, figure out what makes the most sense for you. But I think the issue that we have is that climate change is an existential crisis. And we all know that it is a critical issue that is impacting the health of people in communities around the world right now. And we could see it in changes in weather events. We can see it in extreme heat. We can see it in a longer hurricane season. And so we really need, as a country, to focus on what we can do to not just mitigate, but to really try and prevent some of these issues around climate change. So it's always going to be there. It is now one of those underlying issues that public health always has to deal with, and it has to remind the public that climate change is about, yes, the ice caps that are melting and about things that are happening in places that seem really far away, but the impact on people right now around the world is real.
Yeah. And I think that's really amazing because, at Franklin County Public Health, we do a lot of stuff in this space. And it's, maybe it's not on the national level. We're not in like changing policy necessarily, but we're doing things like we have our air quality monitors all around our jurisdiction that's gathering data for us. And we have actually an event coming up here shortly, our lawnmower exchange that we do every year in partnership with one of our local hardware stores where people can change their gas mower for an electric mower, which is really cool. So it's fun to see. It's fun to hear, the impacts that are obviously up in the national level and things like that, but to know that even the small changes we're making here at the local level matter.
They absolutely do matter. And the other thing is that what's happening in Franklin County is different than what is going to happen in Cook County, where I grew up, or that's going to happen in San Diego County. Each community has different issues that they have to deal with, and they deal with in a way that makes sense to benefit the health of the people that live there.
Yeah.
Absolutely. And I know that the next topic for Public Health Week is health equity. Can you speak a little bit about that?
So I mentioned a little bit earlier that is an underlying principle for EPHA, and we know that there have been there's longstanding issues that impact the health of people differently, and some of those are institutionalized, and some of those are unseen, and some of those are directly built into law and policy. And so we need to make sure that everybody has the chance to be healthy. And the truth is, right now, we're seeing a huge attack on health equity. And I think it's because a lot of people don't understand what some of these terms mean. But what we're talking about is that no matter where you live, no matter where you start, no matter what color you are, what gender you are, what sexual preference you have, no matter what your abilities are, that you have an equal opportunity to be healthy, and that we really make sure that the rising tide lifts all boats. It's not either or, it's making sure that everybody has the same opportunities.
Absolutely. No, and I know here at Franklin County Public Health, equity is such an important part of what we do too. And just a couple of examples of that. During the COVID pandemic, we declared racism as a public health crisis. And it's something that we really prided ourselves on doing because we know how important that issue is. Also, we have an Equity Advisory Council, an EAC, that we're really really proud of as well, made up of local groups, different diverse communities. African American male wellness is part of that. There are partners and many other things as well. Just representatives from a variety of different groups, sort of as a meeting place for both cultural groups and for resource groups for folks who need resources as well. So, those are just a couple of ways that I think Franklin County Public Health plays into that health equity as well.
I think it's really cool that you have an equity advisory council. That is such a great opportunity to understand the community needs. And the racism as a public health crisis is also a really important marker to put out there.
Mm.
And I don't know if you know this, but APHA has been collecting information about the different communities and counties and states that have declared racism as a public health crisis. And we have a map of where those
Oh.
things are around the country. And so we should all look after this call to make sure that Franklin County is on the map.
That's really cool. I didn't know you guys had that. That would be an interesting visual to see. Um, I know that another piece of the pie for National Public Health Week is advocacy. Can you talk to us a little bit about why that topic in particular was selected for this week?
I think for a lot of people, advocacy is a scary word.
Yeah.
They don't understand what advocacy is, or they feel like they're restricted from being an advocate. But the truth is, three of you are doing a podcast. You are talking about public health. You are being advocates for public health. That is one way to talk about it. I go home and I talk to my 94-year-old dad about the work that I do. I'm being an advocate for public health. But the other really important way to be an advocate is to be a public spokesperson. And that means talking to the media. That means talking to city leaders, mayors, council members, state legislators, your federal legislators, and educating them about what public health is, what it does to the community, what happens when we see cuts in funding for public health,
Mm-hmm.
where the needs are, the evidence-based programs that are making a difference in people's lives. And so it really is an important part of public health. And unfortunately for many people, it's not something that they learned in school. It's not something that
Yeah.
they were educated about in continuing education. And so it is, and for a lot of people, it has to be a learned skill. And
Yeah.
that's part of what we try and do is we try and educate and train people in how to be an advocate.
Yeah. I really appreciate you sort of expanding that definition of advocacy because I definitely agree. I think that's a word that it has like a very specific image that it brings to mind, but in reality, it is such a it's really an umbrella word that captures a lot of things. And, thinking about at Franklin County Public Health here, we have our community health action teams, which is a really cool way that we go into our different jurisdictions and we bring data and we look at it with community members and say, okay, here's what's going on in your community. What do we want to tackle together as this group? And then we go and make change. And that's what's really cool is that like that in and of itself is advocacy. So I appreciate you expanding that definition for sure.
A lot of people think of advocacy as lobbying.
Yes.
And that's all that it is. And it's so much more.
Yeah.
Lobbying is obviously a piece of it, and policy and systems change is an important role and goal of advocacy, but there's, again, so many different ways to do it. And your community groups seem like a really nice way to engage people and then start to make some of those changes that they need in their community.
Yeah.
Yeah, and going off of that, the last sort of day of Public Health Week is about the future of public health. So, talk to us about, what the future of public health looks like or what your organization thinks of it as when we highlight it in this week.
So, as I said, this is the 30th anniversary, and part of what we're going to do in the celebration of that is look back.
Mm-hmm.
What have been the great things that we've seen that have made a difference in the public's health, and what have been the greatest triumphs of public health? So, if you think about it, it's vaccines, it's understanding the implications of tobacco, it's making a difference in safe, walkable streets and things like that. But as we move forward, we are facing so many new challenges that some we can predict and some we can't. And as we move forward, we're seeing backsliding on some of the advances that we've made in the past. So when we're thinking about the future of public health, we're thinking about some of the really obvious things, like what's the impact of AI going to be on public health?
Mm-hmm.
How are we going to make sure that we understand how to work with new technology as it comes in? How do we make sure that we are assuring that public health doesn't get lost in an expansion of the healthcare system, that we understand that both need to work in concert with one another when we're focusing on population-based priorities and individual healthcare. I think another issue that we really need to figure out is how to do a better job of educating people about what public health does. The COVID made it very clear that as much as we've tried to educate people about public health, they don't understand how pervasive public health is in their life. And so the communication piece is going to be a really important issue. But another really important issue is doing a better job of preparing for the next pandemic, because it's going to happen.
Yeah.
And maybe we can make it happen in a way that is not as horrifying and deadly and disruptive as COVID was. So there's all sorts of different opportunities coming at us, and our goal is to just try and figure out what those are and be better prepared for them.
Yeah, it's a really good point that you bring up. And, here at Franklin County Public Health, we sort of focus more on educating, like who we can and future generations. So, we have, relationships with local universities such as Otterbein. We offer internships to, young emerging students and graduates and everything to sort of get them into the field and sort of, let them experience it for themselves before they go out and decide what they want to do. And then, of course, the two of us here often give presentations at Otterbein every year talking about social media usage within public health. So, it's really important, like you said, Susan, to make sure that we have to tackle a lot of these things, head on, not just now, but going into the future.
I completely agree. And I love the fact that you guys are going out and educating folks about social media. It is something that public health professionals aren't all that comfortable with. I think folks in your generation, and I hate that I sound like the old person for this, the folks in your generation are growing up in a world that is very different, and the way that you communicate is very different. And if we're going to make change, we need to meet people where they are. So that's really just a wonderful thing that you guys are.
All right, now, something we like to do with all of our guests is ask this magic wand question. So if I gave you a magic wand, and just trust me, it works. You don't have to question, where the magic came from. You've got a magic wand and it works. And you can do anything you want related to public health. What would you do?
Am I limited to one?
No, you can do more than one if you want.
Okay. Cool.
Top 3 things you'd do.
Thank you so much. So the first thing I would do is make sure that we have a fully funded public health system. And that is federal, state, local, tribal. Make sure that the infrastructure is there so that we don't ever have to worry about an E. coli outbreak in Franklin County, not having the epidemiologists and on-the-ground public health professionals you need to make sure that it doesn't spread to other parts of the state.
Yeah.
I mean, so it's that idea of really having a holistic approach to public health. The second thing is I would make sure that the public understood what public health is and what it does for them. We have champions for public health that are public health professionals, but the truth is that we need your business leaders to go into offices and say public health is important. We need the education system to understand, the justice system. We need folks to understand the connection between what we call the social determinants, all of those upstream areas that impact health, that they do impact health. And the third is I would create legislatures all across the country that have a significant percentage of public health professionals in them, so that at every level we have policymakers who are interested in thinking about the big picture, holistic approach to health, and are making choices every single day across all of the choices that they have to make that are going to improve the public's health and not undermine the public's health.
Good stuff. Good use of your magic wand, I would say.
Definitely.
That's kind of fun. I'd love to have a magic wand on a pretty regular basis.
Yeah.
Yeah, and I usually have to make sure to mention to folks, it has to be a public health related thing that you're using the magic wand for. Just to keep people in check, But yours was really good. Zach, do you have anything before we close?
Yeah, I know. Listen, I just want to say to Susan, I've had a great time hearing everything you've had to say today. And it really means a lot to all of us that you were able to join us and everything. And thanks so much for you, for everything you do and for everything that the APHA does. So
Thank you. This was really fun, and there are 1,000 other things that I could and probably should have talked about. Some of the work we're doing in the legal system, some of the work we're doing in regulatory system. But this was fun, and I really appreciated it. And if you guys want me back, I'm happy to be your second virtual guest.
Awesome.
Thank you.
Great to know. Susan Polan, she is the Associate Executive Director for Public Affairs and Advocacy at the American Public Health Association. Susan, thank you so much for coming on the podcast today.
Thank you.
Did you have a politically charged conversation with a family member? Too many emails in your inbox? Traffic keeping you from the growing to-do list at home? Deep breaths can help. Deep breaths are a great way to regulate that out-of-control nervous system, lower your heart rate, and help you think clearly again. Breathing in for 4 seconds, holding your breath for 4 seconds, and releasing your breath for 4 seconds can really make a difference. Our own Zach has tried deep breaths, and here's what he has to say.
Zach, you're supposed to breathe out.
Deep breaths. They help when you do them right.
So who here likes caffeine? Anyone?
Oh, God, yeah. All the time.
What is your favorite way to consume caffeine? Angela?
Coffee.
Coffee?
Coffee,
Okay.
coffee.
So I don't know if I like caffeine. Like, I love tea. I love the taste of tea.
There's caffeine in tea.
Yeah, but I like the taste of it. I don't know if I don't get like a vibe at all from tea. I don't get like I
don't understand
maybe
what
it
you're
is.
talking about. You don't get a vibe from tea?
I don't get like a boost
get a tea vibe?
Yeah, I don't get a tea vibe going. I just like the taste of it. So I'm just like, oh hey, that's a good alternative to water sometimes. So
you're not drinking tea for the caffeine, is what you're saying,
right?
You're
I
drinking
run off
it for
of
like the.
I run off of my body's energy core, whatever that's called.
Lithium.
Like Iron Man, who's got the whatever the core is.
I have. Yeah, that's what I have, and I run off of that.
I'm sorry, I just compared you to Iron Man. That
Why
might
are you
be a
sorry?
bit of a stretch.
Why are you sorry? I think he's a hero. He saved the world.
I was going to compare him to the Energizer Bunny, so I guess yours was nicer.
I would also take that as a compliment.
I would take Energizer Bunny. That's
I
fine.
would love to be a drummer. I think that's great.
Well, caffeine provides no nutritional value on its own. It's tasteless, so you won't necessarily know if it's in your food either. So caffeine doesn't have a taste. Like you said, you just like the taste of tea, not because it has caffeine. You just like the taste.
Yeah.
But caffeine does affect us. It almost always causes some symptoms. I'm reading from Healthline here. At minimum, you may feel more energetic, like the Energizer Bunny here, Zach Watson.
Mm-hmm.
But over time, too much caffeine may cause withdrawal symptoms.
Yep.
Angela, it sounds like you have a little bit of experience maybe with that.
Correct.
Okay. So every day, coffee for you?
Yeah, every day.
Morning?
Yeah.
What kind of coffee do you go for?
Any.
Not specific. Do you make it at home? Do you go out and buy it? What do you like to do?
I normally make it at home. And when I come into the office, I will treat myself with a cup of coffee from one of the local coffee shops nearby. So,
well, according to the Mayo Clinic, it's safe for most healthy adults to consume up to 400 milligrams of caffeine per day. That seems high.
it's honestly not.
Okay. We've got an expert here, ladies and gentlemen, on coffee
Do they tell
consumption.
you how many ounces that is typically?
So the average 8-ounce cup of coffee has 95 milligrams. So if the daily consumption is 400, that means you can have 4 cups of coffee. Does that seem right?
Sounds legit.
It says it's safe for most adults.
Safe.
So not recommended, but like you won't cause physical harm to yourself, I guess, if you have up to 400 milligrams.
Well, but also keep in mind, like if you go to Starbucks, right, for example, their smallest cup is 8 ounces.
Oh, okay. And their
you're
small is called like
A
large or something, right? Yeah.
Yeah.
I always
think.
hated that.
I don't know. It's very confusing. Can't you just say small, medium, large?
Yeah.
Starbucks,
Grande,
change yourself.
Grande
please.
means large in
Right.
Spanish, but it's not a large, right?
It's a 12 ounce.
Which is like a medium, right? It's
Listen.
ridiculous.
But all I'm saying is like a lot of people don't typically go to Starbucks and get the smallest version. They'll get like,
Oh, here we go.
yeah.
Big ol' cup.
Okay, so a tall, which is a small, I just can't get
Yeah,
over that.
Starbucks, let's go. Okay.
Starbucks, a tall is 260 milligrams.
Correct. So like if
So that's
you're
over half of your caffeine for the day in terms of being healthy and not causing yourself physical harm.
yeah.
Just a small Starbucks coffee.
Right. So if you go to Starbucks and get like a venti,
A venti, which is a large, and
Yeah.
that's 410. So you're already in the unsafe territory if you
Right.
simply drink one large coffee from
and
Starbucks.
then if you get like some fancy business with like an extra
Espresso.
shot or something like that, listen, it's just a lot of caffeine.
Actually, Dunkin' Donuts, I don't know if anyone...
No.
Okay,
Sorry.
well, that was quickly shot down. I will say Dunkin' Donuts has less caffeine in their coffees. America does run on Dunkin', I've heard.
America
I've
does
heard
run
that.
on Dunkin'.
A great slogan. Don't get me wrong.
It is a great slogan. We should have put that in our slogans,
Shoot,
but
you're
we
right.
didn't.
I want to talk about how so there's two things I want to talk about. So I don't like, again, my caffeine usage. I cut out soda a long time ago, and so it comes from tea and stuff like that. But when I was younger, I would have to go down. I would visit friends, like in different cities down south, like 14-hour drive to Louisiana and stuff like that. And when I was really dragging in like hour 11 of a 14-hour drive, I didn't know what would keep me up. Like Red Bull just like wasn't doing it.
It wasn't giving you wings?
It was not giving me wings. It wasn't. So I would pick up, and I don't even know if they make it anymore, but at the time I would pick up a Starbucks double white mocha with guarana.
What is that?
At the time it was an energy, like Starbucks had energy drinks. I think they still might.
Whoa.
But so it was a white mocha coffee with guarana, which I'm pretty sure is what is in 5-Hour Energy, if I'm not mistaken. I called that drink the Widowmaker. The drink would work really, really well. It would boost you for about 2 hours. I've never experienced a caffeine sort of rush like that. Like I was so like blitzed on caffeine alone that like
oh my God.
that I was hearing like this. Do you know what the Super Mario theme is when he ingests like the star? Like he's a fast Mario. That was playing in my head for about a full 2 hours, and I'm like white, and I'm just like
It was like you were in Mario Kart.
it really was. Now the crash was debilitating.
Oh,
Not the car crash.
No,
Oh,
sorry. The
okay.
energy.
I was like,
no, that's also fair.
That's really dark.
That's also fair because I think I could have driven that car through bank window and came out like unscathed, like and just been like woo, just like I've never
Wait,
experienced.
like what?
Like woo, so I've never had anything like that, but. What would happen? Like I'd only tried it twice, both on trips to the South, and both times, like at that 3-hour mark, my arms would feel like they had cement blocks on them, and I like we were getting right into the city, like we would be like only miles away. Both times we were like miles away for where we were supposed to be, and they're like, "How are you doing?" And I'm just like. I feel so good. Like it's like being like slowed down, like speed
moving
wise
through quicksand.
Yeah, and I would just collapsed. I just collapsed when I got to the places we got to, and would both occasions I think I slept like 12 hours.
Wow.
Yeah,
Quite the crash then. You're saying.
quite the crash. Yeah.
So
What-
guarana, like overall, like
Just the Widowmaker. Do not
Okay.
do not get a Widowmaker.
Well, you know what I think is interesting though too is I feel like there's been a recent wave of like healthy energy drinks, like
Right.
Alani Nu, like the oh my God, what was the other one I just saw?
Celsius. I've heard of that one. I prefer Fahrenheit just because I'm an American, but Celsius also. When are they going to come out with Kelvin? I mean, come on.
Oh my God.
That's for the nerds out there. All right.
Good one. But yeah, no. So anyway, I just think it is sort of interesting, this concept of like these healthy energy drinks when in reality, like
None of them.
maybe they don't have a lot of the additives that are in like your traditional Monster, Red Bull, whatever, but it's still like they're still not great. Like the amount of caffeine that they deliver is just wild.
There are so many kinds. I feel like there used to be about 4 energy drinks, and now
And
there's 400.
Unbelievable. Everyone's got their own.
Yeah, I mean, caffeine is, a double-edged sword, right?
Yeah.
Because it keeps you awake, which is the point, keeps you going. But it also has some potential long-term issues for your nervous system.
Mm-hmm.
Some people can use caffeine to help treat migraines or headaches. But on the flip side of that, too much caffeine can give you headaches.
Correct. Yes.
So,
and when you don't have caffeine and you're addicted, you
Yeah.
will immediately get a headache.
yes, some symptoms here I'm reading of caffeine withdrawal, and maybe you can speak to if any of these are happening to you at this very moment.
Probably.
Anxiety,
Yep.
irritability.
Yes.
It says irritability, especially with Zach Watson at the table. I don't know why it says that.
Crazy. Yeah,
And
that's accurate.
drowsiness also.
Yes.
That's her.
That's her.
That's
the
the
Widowmaker.
Widowmaker.
People can't see, but thank you for sharing.
Yeah.
She
A
indeed does look
Starbucks
like-
double shot energy.
Good God.
Double shot energy with B. Don't worry, it's got B vitamins. B vitamins, ginseng, and guarana.
Well, how much caffeine does it say it has in it?
You said B vitamins, more like B no vitamins. Am I right? Where's my?
I need you to leave. Even I can't go there.
There we
There
are.
you go.
145 milligrams, it says,
No way.
which is less than I was expecting.
So it must be the ginseng or
Yeah, there must be
guarana.
other
Guarana.
the guarana in there.
It
Something
could
is-
also be the fact that I'm looking. Okay, let me look at this again. So keep in mind that's a bunch of caffeine, and the sugar content
Oh,
is at 29 grams of sugar, which is about where I would expect it to be.
but when you add those two together,
Yeah, it has 240% of niacin. Niacin. I don't know which one.
niacin.
I don't know what.
Niacin.
I think niacin maybe.
Niacin. I don't know.
Oh yeah, I've got that too. But you got 260% of riboflavin. You got to have your riboflavin. Riboflavin. We can't pronounce anything.
Clavin, riboflavin.
Oh my God.
They're B no vitamins. There we go. That's a callback.
Why has this not been outlawed by the FDA?
Does anyone remember Surge? The
No.
drink Surge.
Oh, I remember Surge. Yeah.
Okay, so Surge came onto the scene. I'm looking here. It was originally launched in Norway as Urge, which I thought was
Love
funny.
it. Love it.
But it came to the United States 1 year later, 1997. It only lasted till 2003, but I remember that as being basically like the precursor to an energy drink. Like it was a soda with just a lot of caffeine and a lot of stuff in it.
Yeah, it was like Sprite on hard drugs, like that, because it was like lemon lime or even like Mountain Dew's
Mountain Dew adjacent.
Mountain Dew's
Ew.
backwater cousin that you really didn't want to see. Surge.
Yeah, I always thought that Surge was discontinued because of like health things, but actually I'm reading Surge was discontinued just because of slumping sales. Like people weren't buying it.
Yeah.
Anyway,
Look, we're not saying don't drink any caffeine. Like obviously
It's all
that's
about-
not
it's all
that's
about
not
moderation.
realistic. It's about moderation. It's
All
about making sure
moderation.
you're being healthy and you're not taking it too far,
Yeah.
because then there can be some symptoms to that. So
I'm just saying, say it with some gusto. I did that to make you so mad.
gusto.
I
however-
did that specifically to make you mad.
I gotta go.
Thank you for listening to the Health is Real podcast from Franklin County Public Health. We want to hear from you. Let us know your thoughts at fcph@franklincountyohio.gov, and be sure to follow us on your favorite social media platforms. And did you know that we offer vaccine clinics and education throughout Franklin County for both children and adults? Talk to a public health nurse to ask questions or schedule your vaccine appointment by calling us at 614-525-3719 or email shots@franklincountyohio.gov.